Hello, everyone. It's Friday, October the 2nd, and I've got a golf shirt on because I'm going to be, Dr. Amjad's going to give me my flu shot in just a little while, and I'm sure that it'll be painless as it is in every way. But before I go any further, I'd like us as West Virginians, and from my standpoint, I know there's many people that can deliver prayers so much better than I could. But I really feel that we as a nation, and especially West Virginians, need to offer up a prayer for our president and the First Lady. So if I could ask you just to bow in prayer just a second, and I'll give it the very best that I can give it. But dear Heavenly Father, our Bible teaches us to offer up in prayer for our leaders all the time. I am close with the president, and I know our president is Donald. But Donald J. Trump and his beautiful wife, Melania, our First Lady, and our president of our nation, have now been tested positive for this dreaded disease and this dreaded killer. So I know as our leaders, and especially our president, moves forward, I'm with him and I feel his pain. And I also know the errors that he takes as he charges up the mountains. I oftentimes think about Ronald Reagan. When he was our president and he was dreadfully shot, and as he entered the hospital, he walked in the hospital. And then they quickly got him to the operating room, and he looked up at his surgeon and said, "I hope all of you are Republicans." And the surgeon replied back, "Mr. President, today you can be assured we are all Republicans." Well, I would ask all of us just this, that today in this country, whether you're an independent, a Democrat, or Republican, I would ask, as this country is divided in a lot of ways that we shouldn't be, that especially today, we all come together as not Democrats or independents or Republicans, but as Americans, and offer up that prayer for our president and our First Lady. And also, as we conclude, I would offer up a prayer to God above for the now 355 West Virginians that we've lost. And in every way, I would pray that God above, that you show all of their loved ones that you've got this, you're in control. And everything is some way, somehow going to be okay. But I ask these words in God above. Amen. Thank y'all so much. Before I go any further, I guess, we better go through the fact that, that we have now lost 5 additional loved ones, or West Virginians, since Wednesday. Our 351st death is a 70-year-old female from Ohio County. Our 352nd death, a 79-year-old male from Berkeley County. Our 353rd death, a 61-year-old male from Kanawha County. Our 354th death, a 48-year-old female from Marion County. And our 355th death, an 89-year-old male from Marion County. Like I said, I hope and pray that as we go forward, first and foremost, my prayers would be that we would find a cure or a vaccine to this dreaded disease and put it in our rearview mirror. But from the standpoint of as we go forward, the odds are we're going to lose more. And as we do, please don't let them just become a number. Don't let them become a statistic. They're great West Virginians, and we'll miss them, and we appreciate their contribution. Okay, from the standpoint of our numbers, our daily positivity rate today is at 2.80. That's not too bad. Our cumulative rate is at 2.77, and that's kind of hanging in there. We now have active cases of 4,153. Our recovered cases are 11,799. We still are hovering around this 160 some odd number, but 164 patients that are hospitalized. Our effective reproduction number is at 0.94. We're now the 7th best in the country. We don't have any counties that are in the red. We have, Taylor, Harrison, Upshur, which are all new counties that are moving into the orange that we're concerned a lot about, and Boone County as well. And very, very, very happily, I can tell you that Kanawha County has moved from the red to the orange, and now they're in the gold. And so I'm really, really proud of a lot of great work we've done there, and I'm going to touch on it. Well, I'll touch on it right now. Here's the thing. Over the last few days, we have really expanded the testing in Kanawha County, have we not? And we've expanded it a lot of different places, and we're going to continue to do just exactly that. Now, let me tell you just what we've done, so everyone will really understand. We have tested 2,054 people at these events in Kanawha County. Well, I think we have a much better cross-section of what Kanawha County is really doing. But here is the whole key to everything. We found 85 people. Out of 2,054, we have 85 people that have come back with a positive test. Now, what does that mean? It probably means that those 85 people were walking around and had no earthly idea that they had this disease. Now, if you take our RT rate today, and we're the 7th best in the country, if you take that RT rate of 0.94, what that means is for every one of these 85 people today, they can be infecting almost one person for every 85 of them. Not quite one. Let's just call it 75 of the 85 that they would infect today. Well, that total becomes 160. And then those 160 immediately infect 150 more. That total then becomes 310. And then the 310 immediately infects another 300. And before you know it, you turn into exactly what we've been. Red counties, a positivity rate shooting through the roof. We could never have identified those 85 spreaders if we hadn't aggressively tested. Absolutely, that is the key to this entire thing. Now, we need you to continue to come out and be tested in Kanawha County and in all counties. When we're offering up the testing, come out. I think we're at Riverside today, or going to be there, over the weekend. It's today. Now, if we're at Riverside today, come on. Get out there and get tested. The more we test, the more we learn. Absolutely. The absolute whole key to this thing is finding the spreaders. When we find the spreaders, we absolutely shut it down. When we find the spreaders, they absolutely will get well. We will stop people from dying. The whole key to everything. That's why I said this could very well have been our best work, our very best work. I mean, if I could tell you that today in Kanawha County, we found 85 people that didn't have a clue that they had this disease, and we stopped those 85 from spreading it to others, and we stopped the 85 from spreading it, and then them spreading it, and absolutely causing additional deaths. then what have we done? We've done good work. So I commend all those, DHHR, the National Guard, the local health departments, everybody from Q Labs right on down, everybody that has really, really stepped up in this big effort. This is the effort that we need across our whole state. This is the effort that we've needed and now we're on our way. And I will promise you, whatever it costs, not only can we do it, we will do it, and not only should we do it. Now, I can tell you that, you've just got to watch our website for all the places where we have our free testing going on. And I know we're testing in Taylor and Harrison and Upshur counties that are all in the orange today. And today and this weekend, we'll be offering free testing in all 3 counties. And I would encourage everybody, go out and get tested. Absolutely. If you'll continue to do just that, we'll stop this thing. Now, I'm going to read through these announcements pretty quickly. It was brought up to my attention 2 different times. People ask about the possibility of athletes, being encouraged by coaches to show up and get additional testing and all that kind of stuff and have multiple tests, being done. We've investigated it from, with 2,000 plus tests and everything. We found 13 incidences of this type of behavior where we threw out 13 tests. We're not sure if people were just coming because they were feeling bad or whatever it may be, but almost none out of 2,000 when it really boils down to it. But the one thing I'm going to do, I'm going to ask Bernie Dolan with the SSAC to issue some type of ruling or whatever it may be that says basically that if we catch a situation to where people have abused or fraudulently trying to, to scam the rules or whatever like that and come and have multiple testing and all that kind of stuff, and they're trying to do that, I'm going to ask Bernie Dolan to come up with some level of suspension and or punishment, for those coaches and or athletes, because it's the wrong message that we ought to be sending. And from my standpoint, if we're going to do things like that we should not be doing in any way for the sake of playing a ball game, when this is so serious from the sake of people that are dying. And if we're going to do that, then I'm very hopeful that Bernie will come up with the proper punishment, and I would hope that it would lead to suspension of games and whatever it may be. From the standpoint of we get requests all the time about live music and everything, and we are opened up on lots of different things. We're working this. We're working, through all the guidelines to be able to find ways that we can do that. I don't really see any reason why in the world that we can't have live music outside and come up with ways that we don't have to take that away and everything. And I know we have taken that away and suspended that. We're really close to figuring that out, and we're going to get that done and everything. But you just have to give us another couple of days. I want to encourage everybody again to take their flu shots. You'll see me get mine in just a little bit, and so I encourage everybody to get out and do that. We have 19 active outbreaks with 46 confirmed cases in our public schools, and Clayton Burch will talk, maybe some about that in just a few minutes, but I think we're handling that very well. We have 37 outbreaks in our long-term care facilities, and we continue to run to the fire there. We have 11 now outbreaks in 7 different counties in our churches. I keep warning you about this. I know just how important church is in every way, but I keep warning, and please read the guidelines, take the guidelines to heart, and keep that pew in between you. Wear your mask, please. And on a corrections update, we have 5 active inmate cases, 4 at Mount Olive and 1 now at North Central, so that's going down. We have 16 active employee cases, including 9 at Mount Olive. As far as our grants in our cities, for our cities and our counties, we're now up to $132 million. It's been awarded, and we continue to ship that money out, and you can continue to apply, and we encourage you to do so. All that's good work. Our census is still at 99.9%, and I don't know how in the world to continue to encourage you or whatever, but you've done a whale of a job there. It's really great stuff. Our DMV, from his follow-up on a question that was asked on Wednesday at the briefing, all DMV offices are currently open across the state for both appointment and walk-in visits. They are taking all the necessary safety protocols and everything to keep the people safe. And last week, we had 6,724 West Virginians that made an appointment at the DMV. And we also had 6,394 walk-in across the state. You see all the stuff on our website and everything, so go up and get an appointment or whatever it may be, to DMV or go to the DMV and do the walk-in visit. Now, I've got one more thing to announce, and this is really important and everything, but just the other day, I was at the dedication of a 54-mile stretch of highway from the split of I-64 and I-77 all the way back down to almost to Canal City. And it was a dedication, and it was going to be the Gold Star Family's Memorial Highway. The leader that has taken on this movement across the whole country is our own, Medal of Honor recipient, Woody Williams, and Woody is an amazing man beyond belief. It is just phenomenal what he does and everything. But today, we also had a virtual dedication ceremony for our Gold Star Monument on the grounds of the Capitol. Now, it is the largest, which it should be in West Virginia, the largest Gold Star monument in the nation. And there you'll see it on your screen. It's beautiful beyond belief. Many will come and visit and see and have their pictures taken there. It is an absolute testament to the greatness and the sacrifice that these families and their loved ones gave to all of us. The ultimate sacrifice beyond belief. Woody wants to have a huge celebration at West Virginia's birthday next year, June the 20th. And we'll have that celebration right there when all this COVID stuff is behind us and everything. And but today I want to do one other thing, and that is wish Woody Williams the happiest of happiest birthdays. 97 years young. What an incredible man. And so all West Virginians, stop by the Capitol complex and see this incredible monument and everything, and it is just unbelievable. I was really proud from my standpoint. When they got close, we had to throw in some extra monies, from the governor's side, and it was a real honor. So I'm glad to be just a grain of sand, a little teeny piece in making all this become a reality. But what a man, Woody Williams, and I thank you, Woody, from the bottom of my heart for your friendship and all the goodness that you've given all of us for 97 beautiful years. But really, that's all I have for today. I ask you to offer up your prayers for our president and our first lady, and that they'll come to a very speedy recovery, and things will be okay there too. But the same for all of us. Thank y'all so much.
All right, thank you, Governor. First today, while the governor gets ready for his flu shot, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Want to wish Woody a happy birthday on behalf of all. Want to wish Woody a happy birthday on behalf of all the men and women in the West Virginia National Guard and our families. Today, we have 385 men and women from the National Guard on duty on COVID response. Good news is tomorrow, 193 additional West Virginia Guardsmen will come home from deployment. We'll be arriving sometime late tomorrow afternoon at Yeager Airport. We continue a significant amount of testing initiatives, as the governor pointed out, working diligently to make that testing across the state of West Virginia happen in support of our DHHR and our local health department partners, as well as others. I want to pay particular tribute to local Charleston lab, Q Labs, who did an outstanding job of taking on the throughput of the additional testing that we've done in Kanawha County and getting that through, bringing extra staff on. Also, a couple young guardsmen, as some of the test lanes had slowed and there were some issues with getting the test electronically transferred into the system, jumped in with some extra iPads and worked to help with Q Labs and others to make that happen. Just shows the work going on behind the scenes from a lot of young folks doing a great job. And Jordan, I think we have a video, if we can bring that up. Earlier today, as the governor pointed out, I jumped in and got my flu shot taken as well. And I didn't cry, folks, so it's all good. It's not that painful. Jordan, I want to turn it back over now to the governor, and I think he's going to jump in on that as well.
All right, thank you, General. Governor, we'll turn it back to you.
Here we go.
Okay, so the governor's ready to get his flu shot, and we're not going to give his exact age, but he is a little older than 65. So if you're older than 65, there is a high-dose vaccine that you can get. So we have that ready for him, but he's ready to go. So we're going to go ahead and clean his arm up here. And he's not afraid of needles. He's not allergic to eggs. He doesn't have any problems right now, so he's ready for it. And it's just a quick little shot that he gets. Doesn't hurt or anything, and that was it. So.
No, that was great. Now I get a pretty Band-Aid, don't I? Now show him the Band-Aid.
Well, he gets a Spider-Man Band-Aid.
Okay, I love it.
Special one for him, and there you go. And
okay.
And I brought something else for you just to cheer you up. It's a little ring pop. So.
Okay, I got a ring pop and a Spider-Man Band-Aid. You can't beat that.
That was it, guys. So not too bad.
No, that was nothing. That was absolutely nothing. And so get your flu shot. Yep. West Virginia, especially, all of you out there. We need to get everybody a flu shot. That's good. Good stuff. Thank you. Thank you so much.
All right, thank you, Dr. Amjad. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, hello, and it's great to be with everybody today. I want to join the governor in our prayers for the president and the first lady, as well as all the people in our country who've been affected either directly or in their family or in their friends by COVID-19. I think it really reminds us again of how important it is for us to be very, very committed to, as the governor has said many times, of running to the fire. And that means go get tested, wear your mask, stay physically distanced, wash your hands, avoid the 3 C's, and make sure that you take care of yourself so that you can take care of your whole community. I just want to touch base on a couple of articles that have come out this last week that I think give us a really important message, which again is something that the governor articulated, and I want to expand on it here very briefly. So in a study that came out, the largest study that came out from 2 villages in India, there was the observation, as we've talked about before, that a very small number of people, about 8% in this study, were responsible for about 70 to 80% of all of the infection transmission of COVID to others, while 70% of people who are infected don't infect anybody else. And so as we see the president, the first lady, get infected, along with Hope Hicks, who tested positive as well, the spread of the clustering of people who are infected starts to direct us toward identifying people who might be super spreaders. And we worry that there's somebody in the president's inner circle who may fit that bill. And remember, one person in South Korea early in their pandemic infected about 5,000 other people. So the only way that we can identify those people before they can spread to many others, as the governor said, is to do really extensive testing and really encourage people to go out and get tested. That not only can drop your percent positive rate, which is important for people to have their schools open and the sports events to start again, and to make sure that their businesses stay open, but really much more importantly, this is the way that we start to create healthy communities. The only way to reduce the spread of COVID-19 and the burden of COVID-19 is to identify these super spreaders early, separate them from others, and then what we see is that the infection rate also goes down in the communities, and we're starting to see that in West Virginia. Fewer people have died in the last several days. Our RT value, the reproduction score, is less. And so we're really, I think, starting to get a much better handle on what's going on in our state with COVID-19. And I really credit the governor with challenging us to continue to evolve this strategy and to add the percent positive rate, as the Centers for Disease Control have done as well, because it really does allow us to start to identify the people that we need to separate from others and reduce the spread of COVID-19. The only other thing I would say to people who are watching is, in counties that have improved their status, where maybe they were red, as the governor talked about with Kanawha County, or orange, now gold, or Mon County, now green, that it's really important that the citizens not give up their focus on making sure that you do those protection measures, even if you're in a better color, because what we're really trying to do is not only reduce the spread of COVID-19, but to keep that spread down so that West Virginia can be a safe, great place for people to come, to move to, and to be a place that every other state can measure themselves against. So thank you very much.
All right, thank you, Dr. Marsh. Next, we'll go to West Virginia Superintendent of Schools, Clayton Burch.
Thank you, Jordan. So this is my first day back. I've been on the road most of this week, and I want to give a brief update of my travels across West Virginia. It's been a wonderful week. The governor, our board president, Miller Hall, we all celebrated Tuesday night the 2020 Teacher of the Year, as well as the Service Personnel of the Year. And we are so proud of Erin Anderson. She's a 20-year veteran 5th grade teacher in Upshur County. And our Service Personnel of the Year is a 37-year-old veteran bus driver from Gilmer County, Susie Kirkpatrick. I went on the road to visit each of them individually. That was a live event we did. You can still visit it. It's had about 19,000 hits, and people have tapped in to see that. And I got to say, what a great experience going to meet those wonderful people. And Susie, especially to you, President Hall looked at me during the event and he said, "Clayton, is she at football practice?" And I said, "Yes, sir, she is." She is not only the bus driver for Gilmer County, she's also the athletic director. And what a wonderful lady, and what both of them represent is what I saw in my travels across the state, and that is stepping up, taking care of children. They all talked about their experiences all the way back to March, what they did in the spring, over the summer, and talked about how important it was to have those children back in front of them. And I wrapped up yesterday. I was invited to meet a roundtable of folks in Jefferson County. There is a superintendent there. Her name is Dr. Bondi Gibson. And Dr. Gibson has taken all of our recommendations absolutely to heart. She takes it very serious. As a matter of fact, as the state superintendent, I was not allowed to go in and visit a classroom of children. Can you believe that? And she says, "No, sir. We're going to protect our children. We have very strict protocols here. We're all following them. And, but we have a round table for you to meet. We all wore masks. And I got to sit down with a 4th grade student, a high school student, parents, and bus drivers and custodians, a band director, principals. It was a wonderful, wonderful day because each one of them said actually something very similar to what we just heard Clay Marsh say, and that is we have to take care of our community. The better we do taking care of our community, the better we do all wearing masks, we can ensure that our children get to stay in school. And I cannot thank each one of those places that I visited enough for really reminding me how important it was for our children to be in school. So, Governor, I will tell you that a lot of what we're talking about here with mask wearing protocols, it's really resonating out there, and people know that we've got to follow those rules to make sure our children stay healthy and stay in school. Thank you.
All right, thank you, Superintendent. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. I want to just talk a moment about the changes to our dashboard. We're constantly trying to keep that up to date and to provide as much information as we can to you. If you look at the overview on the new map, the new county alert system page where the map is, we have a pop-up buttons for cumulative percent positive that shows the counts that are included in the to calculate the percentage. Pop-up buttons on the daily percent positive that shows the counts that are included to calculate that percentage. We've added 3 rates for each county. The infection rate, the daily indicator is actually the color based upon the metric that's the lowest of the 2. We've added an infection rate trend line with color-coded numbers assigned to the color the county would have been that day, and then the percent positivity where we've color-coded the numbers to assign a color to the what the county would have been that day based upon that indicator. So you can also click some other buttons there to get additional information. We're trying to provide more and more information. The 7-day trend has some changes to it as well. We're trying to provide actually on the dashboard the numbers that are used in the calculation so that individuals can pull those numbers up and look at that data. We're also working on a video to try to provide more information in terms of what's on the dashboard. I suspect a lot of individuals are not even aware of all of the right clicks you can do to provide tables and to provide more information there. So again, we appreciate suggestions that we've received over the past few weeks. We're already working on additional changes. I want to thank Tim DePar again, who has taken this as his project for us, for DHHR, and for the state, and to try to make that information available and transparent to everyone. So we appreciate very much the suggestions we get. Thank you, Jordan.
All right, thank you, Secretary. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I think the majority of the other reporters on the call already got this email, so I was going to go ahead and ask about it. We got an email from a reader who said there's a major discrepancy between the number of positives counted for percent positivity versus the number of positives counted for the incidence rate. The example given is Barber County. The incidence rate was calculated using 31 cases, but the percent positive calculation only used 10 cases. Could somebody explain the discrepancy between those numbers?
Governor, I'll go ahead if that's okay. I have not heard that. We'll look into that quickly. Again, the information that comes in is at midnight last night. The information has not been vetted totally by the local health department. There are several ways that data could change, which is the county of residence. We end up many times where we have outbreaks in nursing homes, for example, but the individuals who are tested there in one county may actually reside in an adjacent county or a contiguous county. So We look for county of residence. We look for duplicates. And these are investigations done by the local health departments in these counties. So you will see data change over a period of a day or two as that information is investigated and vetted. It's another reason why we use Thursday at midnight for the Department of Education map to make sure it's accurate and that we have good data. But we'll look into those immediately, Charles, and make sure we have accurate data there. If we make a mistake, we'll tell you and we'll correct that data. Thank you.
All right, thank you, Charles. Next to Taylor Stuck with the Herald Dispatch.
That wasn't an answer.
Hi, everyone. It's Taylor. I was wondering, this kind of follows up on what Dr. Marsh was talking about caring for your community. But I'm seeing, we have more cases than obviously we did when we first started and we sent kids home from school and things. And we started all these new guidelines. And I'm seeing kind of in the community, those guidelines maybe being a little lax on them. Walmart is an example. They've, taken away, you can go through both doors now and they don't have the people outside counting heads to make sure they're at capacity. So I was just wondering, are we just learning what works now and what doesn't work to keep us safe? Or do we all need to be reminded that we're still under these guidelines from the health departments and that we need to be following them? Thanks.
Dr. Marsh, before you go, let me comment just 1 second on this and everything. I think I'm sure what Dr. Marsh is saying is just this: is as we improve. I mean, let's use Mon County for an example. Mon County was red, and then we pulled out the WVU students and we put students over in Arnold Hall and we're being able to treat and control and do a lot of things that are really, really, really good and everything. But the net of the whole thing is just this. Anybody and everybody saw last night, and I saw it at 1 o'clock this morning, where our president and our first lady were tested positive. Now, if the president of the United States of America can end up with COVID, and if the leader, in Britain, Great Britain ends up with COVID, it can affect any of us, can it not? And all I think Dr. Marsh is just saying is what I have said over and over. Just don't let your guard down, West Virginia. I mean, keep doing the great work you're already doing. I mean, when it really, really boils right down to it, in anything, the novelty of something, the alertness goes higher. The more we have to deal with anything, we begin to ease off and drop our guard. Well, this guard can kill you. It can flat absolutely kill you. So you've got to absolutely listen to what these health experts, myself, and all of us are saying over and over and over. Dr. Marsh, take over.
Well, Governor, I think you covered it very well. In response to the question, I would say yes and yes. I mean, ultimately, we need to maintain the public health measures in our large retail stores and our smaller businesses to make sure that things stay safe for customers there, including wearing appropriate masks and physically distancing. But we are constantly learning about this. And I think the governor made such a good point that the president and his circle get tested on a daily basis, as I understand it. And so this is a ubiquitous and virus that's everywhere. And as soon as we let our guard down, we will have more problems with COVID-19. We also, though, know, and I'll finish after this statement, we also know that the more we test, the more positive cases we're going to find. So initially, that infection rate that doesn't incorporate how many tests we're doing is going to go up, because it's really just a measure of how many new tests we have on a daily basis that then gets corrected for 100,000 population. And the percent positive rate does take into context how many people we're testing. So we expect that will go down first as we identify the right people and test and see that the spread has not been rampant in a community. And then over time, as we get those super spreaders away from others, we expect the infection rate will follow. And we're starting to see that in a number of our counties. So it's really important that we continue those measures, as the governor's told us over and over again, so that we can make sure that West Virginia is a safe place to be. All the counties reduce the spread of COVID, protect our elderly, protect each other, but also keep that spread down, which is really, really the critical factor in our long-term position nationally and in the ability for us to get back to all the things we love to do.
All right, thank you, Taylor. Next to Kenny Bass with WKHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. I do have a question about school. Georgia, and I know the governor has said we're not looking at other states, we're only looking at West Virginia, but it is a national problem and states are handling it different ways. So Georgia's had school open for a couple of months now. During that time, their statewide COVID-19 numbers have been toward the high range compared with the rest of the country, and certainly West Virginia. If you use West Virginia's system, many Georgia school systems will be limited to virtual classes only, but there have been relatively few issues related with in-class learning. Now, early in the semester, 2 high schools did suspend classes, but overall, there have been no major outbreaks. Are we planning on returning to some semblance of normalcy when there's only a viable vaccine? Because most medical experts say it won't be until late next year, regardless of whether it's genetic code, a virus vector, viral-based or protein-based. And even when we get a vaccine, the CDC says flu vaccines reduce the risk of flu illness by between only 40 to 60%. And when we have a vaccine, last season, only 48% of U.S. adults got vaccinated. And this season, even with COVID, only 59%, less than 2/3, say they're getting a flu shot. So at what point does the sample size that we are working with become big enough where real life events create enough data to show that children, especially younger children, are at very little risk and are not significant spreaders of the virus? Do we go 12 weeks or 52 weeks or 5 years? When do we look at what evidence is showing us that we can start moving back to some semblance of normalcy? Thank you.
I think the medical community needs to answer more than anything, but I think there's a tremendous amount of information right now, Kenny, that everybody's trying to process, and I think the indicators are that, just like you say, that from the standpoint of our small children, that they're not the ones that we need to be the most. Well, we need to be the most concerned about our small children, but from the standpoint of them getting it, them being spreaders and all that kind of stuff, I think the information that we have, at least at this time, indicates that, what you're saying is right, that's not the biggest concern, but I'll let our medical community talk about that. Dr. Marsh, maybe you can start.
Sure. Well, thanks, Kenny. And I think that, what you have articulated and what the governor just said are correct. What we do know that as we reduce community spread of COVID-19, the schools tend to be safer and we see less spread. I think that as the governor said, though, there is some evidence that came out of that big study in India that I talked about earlier, that there is the potential that younger children might be able to spread more to each other than maybe to adults. And this is all, information that comes at us real time. And there's plenty of information, as the governor has said, looking at South Korea and China, that children under 10 don't seem to be able to spread as well, particularly to adults and to other people as children that are older. So I think that one of the really important findings in all of the information that we talk about is we have to recognize that we're getting information almost real time. And as we are trying to process that information and put that into context, as you say, we get our own experience both in the US and in West Virginia, and we continue to learn and try to modify what we do in order to try to make the schools and make the communities as safe as we possibly can. And so I think that as we go forward, we will learn more, but it is good news that we haven't seen a lot of huge outbreaks in the state of West Virginia. They've been smaller, certainly at the university, at WVU, as an example, we saw a bit of a spike, and that seems to be under better control. So this is a real learning environment that we're in, and it's one that we have to be constantly vigilant and pay attention to what we're finding. But it makes it even more important that we are protecting ourselves and each other during these times, because whether or not younger children can or can't communicate or get infected as easily because maybe they don't have the right receptors that the virus uses in the human body to gain access. But it's still important that we're all protecting ourselves and protecting our children and our young adults in the schools and our teachers and staff, so we make sure it's safe as we possibly can and make sure that we protect people from getting infected and spreading it to other vulnerable people that might get more severe disease or die of COVID-19.
All right, thank you, Kenny. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. I know we focus a lot on the National Guard, and this is certainly no disrespect to the National Guard members that have been working on this and working diligently. But when it comes to testing, we don't really hear a whole lot about DHHR itself and the epidemiologists and the people in the Office of Public Health. I thought I saw pop across my Twitter feed recently that you all were hiring for additional epidemiologists. I imagine, considering that many of these people probably worked nonstop since the start of the pandemic, that there's probably a certain extent some burnout going on there as well. But I was wondering particularly if Secretary Crouch or Dr. Amjad could talk a little bit about morale in the office and talk a little bit about the work that some of these people have been doing behind the scenes. Because obviously we go to these testing sites, sometimes we see National Guard in uniform, but sometimes DHHR workers are not as noticeable as they work behind the scenes. Thank you.
Bill, go ahead.
Yeah, thank you, Governor. That's a great question. Let me just say our epidemiologists are behind the scenes a lot on this, but they are really driving the train here. We have outbreak specialists who are available a day and night and all weekend. We have folks who really focus on this disease in each county and provide assistance to these counties daily. They are true heroes in this. We understand the issue of burnout and have been working to try to provide additional staff to folks. It's very difficult to find these people throughout the state, throughout the country right now. As you might imagine, they're in huge demand. So we're looking very hard at that. We encourage them to take time off and to have backups for their responsibilities and their duties, so that we have more than one individual who can carry on an issue when we have an outbreak. So they're doing a terrific job, and that is a great question, because they deserve some recognition and some credit for what they're doing behind the scenes on a lot of this. Dr. Amjad, would you like to add anything to that?
Sure. We actually are looking to hire more people, and I did review several CVs or resumes for a state epidemiology position. But it is very hard to find people for the positions. They are in high demand, and as you can imagine, many are looking for positions across the country. But they work very hard. They work way into the hours, and they do deserve a lot of recognition. But they are committed to the state and to find and figure out these outbreaks. But they are in high demand across the country, as you can imagine.
Come back to me just 1 second, please. Let me just say this, that I don't think you very often, hear me not when I mention, those people that are stepping up and doing the great work and everything. I mentioned the National Guard, local health departments, always our DHHR. But the real thing that I think, Stephen, that you brought up is just this. We see our National Guard and we notice our National Guard because of their uniforms. And a lot of times, these people that are doing all this work behind the scenes are somewhat, unnoticed. But at the same time, they're not unappreciated or not appreciated because the work that they do is phenomenal, and they can just like any and all of us, they can get tired and they can get, feeling a sense of burnout, But at the same time, I've got to say this, and I mean this, from the standpoint of our educators, all the different people that are somewhat not noticed. It is amazing. I have not had one situation to where people are absolutely laying down, burned out. These people have stepped up like nobody's business, and that's why I'm very defensive of them. When people, attack them, we'll make mistakes. They'll make mistakes. But at the same time, we've had a lot of great people that have done a lot of good work. And so we just continue to thank them, and we continue to tell them, that we're going to get to the end of this, but none of us are going to quit. None of us are going to rest until it's over. And it just so happens that it's on our watch. So what do? We just absolutely do exactly what I said we'd do. And that is, we can't rest, and we can't quit, and we can't lay down until this is over. But we sure can try to help them, and that's what we're trying to do.
All right, thank you, Steve. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. I would like to try to sneak in two quick questions if I can today. I promise I will make them as brief as possible. Superintendent Burch, I wanted to follow up with you just one more time. HB 206, the funding that was released through the bill, is there an application process or something like that the county schools need to go through in order to access the funds, or will they be directly distributed to the county budgets? And then my second question would be for Major General Hoyer. I was hoping you could speak just for a quick moment about the Kids Connect program. Last I heard, I know we were very near to completion on the program. We may even be 100% complete now. Have there been any measurable fluctuations in the network, either good or bad, detected at any of the Wi-Fi access locations? Thank you.
Sure. So the first part of the question is actually pretty simple. Those are funds that are part of the state aid funding formula. They are directly awarded through their funding to the schools. So they've already had those. There is no application process. They have complete local control of how to utilize those funds under support staff. And definitely General Hoyer can discuss the Kids Connect. They have been very gracious at stepping up, helping us install, adding every armory, I believe, in the state to the Kids Connect project. And he can give an update on that. But there is a website you can go now to look at little over 1,000 places and actual addresses of where those are. And we now have a WVNet hotline for parents and children when they pull up to a Kids Connect location. Somebody will answer your questions if you have any. There are signs, there are posters. We are putting it everywhere if you have any trouble at all. So, General Hoyer?
Yes. So, from our IT folks, we have not had any significant challenges with bandwidth issues. One of the things we will do is I'll ask the public affairs folks from the Guard and Department of Education to make available some information on the unique equipment that is being used. We are also going to work with Department of Education on doing some metrics on how many people are using the various facilities that we have, and we'll try to provide that as we go along. Quite frankly, the only challenge we've had so far is we have a joint armory facility that's used between the National Guard and the Army Reserve, and we're still waiting on approval from the Army Reserve to be able to use some of the site, and we may have to move that to another location. But right now, everything seems to be moving well, and we'll provide you with some insights on the unique equipment and the bandwidth and the use by individual citizens.
All right, thank you, Matthew. Next to Amanda Barron with WSAZ.
Hi, everybody. Amanda Barham with WSAZ. With the increased testing that's going on around the state, I wanted to ask how sustainable the testing is going to be for the long haul. And I guess also when we talk about the revenue numbers that came out, what part of that money, or I guess budget-wise, is going to be put in a bucket, to use your term, for long-term testing in West Virginia? Thanks.
Well, Amanda, I feel like that we've got through the CARES Act and that kind of leads into this. As you know, the House last night in the U.S. House, they passed a stimulus package, and it's on to the Senate. And I really, really believe, I had a conversation with the White House last night. I had two conversations. One of the earlier conversation, we were talking about just the stimulus package, because at that point in time, I had no clue that the president had tested positive, or the first lady. But I have encouraged in lots and lots of ways for us to continue and move forward with the passage of this stimulus package. I think that it will get pared down. It should be pared down for the $2.2 trillion that the House just passed. But I'm very, very hopeful that that's going to be passed, and there'll be more dollars that will be coming to West Virginia and be available to us. But with all that being said, we've really got the money. We've got the money that will, take us for a long, long ways down the trail, as far as, months and or if need be, and God forbid, maybe even years. But we've got dollars that's there, that's bucketed and everything, and we've got a booming economy that has surplus dollars in it there, that if we need to, I'm sure we can go there. I'm sure it would take legislative action to be able to go there, and if we need be, we'll visit that. But right now, we don't need to visit that. We've got the money to be able to endure a tremendous amount of testing and maintain this level of testing, or maybe even expand. It is phenomenal how much work it is and how stressful it is on all those. The Guard has been unbelievably good, but all those at DHHR and all the local health departments, everybody that has stepped up, it is an endurance test, and it is a lot of work. But I go back to this, and I was going to end with saying this later on, but how much is it worth? I mean, if you just think about it, what's the objective? What's the objective with all the testing? There are those out there in the wilderness that'll say, well, the objective is to move the colors on the map. Well, bull feathers. Really and truly, the objective of the testing is just this. How much is it worth? How much is it worth, Amanda, or how much is it worth to all of you? How much is it worth to me that we found 85 people that were positive in our testing in the last few days in Kanawha County alone? How much is it worth to absolutely, and the good people that don't want to spread anything, but they had no clue they have it. How much is it worth to be able to stop that spreading? How much is it worth, and how many lives would we have lost if we hadn't have done this? If we hadn't have identified those 85, how many lives would that have turned into that we lost? Would it have been 3? Would it have been 13? Or would it have been 23? And any of those numbers, how much is that worth? How much is that life worth? Well, I don't know of any of us that can measure that. But absolutely finding those 85, and we're finding people all across this state, and as we continue to test more and more and more, it's what I have said over and over. It may be our best moment, our very, very best moment. So we're going to continue to do that. And we're going to continue to do it in as expeditious a manner as we possibly can. And we got the money to do it, and dadgum, we're going to do it.
Thank you, Amanda. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. Governor, I appreciate you following up on my two questions from earlier this week to get to the bottom of these allegations of excessive testing, especially to try and get student athletes ready to play games in counties that are yellow and may be artificially suppressed by the real numbers. But anyway, I want to follow up on that. Can you, and I have to be careful here because we don't want to commit any HIPAA violations, but can you specify in the 13 instances that were found, how many were parents, how many were student athletes? Can you specify the counties and tell us how you were able to track down these cases, and do you anticipate there might be more? Are you still looking?
Well, Mark, I could defer this to Secretary Crouch or Dr. Amjad, but I'm not going to do that. I'm going to tell you first and foremost that what we have found may be completely innocent. It may very well be that what we found is we've just identified 13 situations where somebody came in for a test and everything, and then maybe got feeling some level of bad in the next couple of days and came back to get another test. I'm not going to tell you that we have anything here that is fraudulent or, bad practices or whatever, but we did find 13 situations to where we had people that came back and got more tests. And so, it would surely be not right. There's no way on earth that I would do it to disclose the location or the names or whatever like that. But I, like I said before to you, Mark, I think that, absolutely, in my world, the magnitude of the abuse is minuscule. And for us to focus on that when we've got the size of stuff that's going on here, it is absolutely frivolous to do that. For us to listen to all the noise that goes on social media all the time that could, some of it could be true, and a lot of it is just fake noise because people don't have anything else to do and they just want to create a problem, And so for us to do that and to focus our attention on that was a waste of time, a total waste of time. We're going to try with all in us to stop all the fraud, to stop all the abuse, to stop people from coming and trying to get multiple tests and everything. But it is so insignificant that we don't really need to be wasting a whole lot of time with it.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, as we were talking about getting kids back to school, one of the themes that you fell back on a number of times was you wanted to put some different eyes on the kids. And I think you were focusing on there are situations out there where there are kids being abused at home. After a month of school, have we seen any indication that any of that was taking possible? And perhaps with Superintendent Burch there, did he give his teachers any additional push to say, hey, let's really pay attention to what may be going on or may have gone on with these kids while they were at home under stay-at-home orders?
Well, Paul, it is Paul, correctly? Correct. I'm going to pass on to Superintendent Burch, but before I do, I want to just tell you this. Being a coach and having the privilege to be with kids as much as I've had to coach, had the opportunity to coach and be with kids all the time, being in the classroom at some of our public schools and having the opportunity to substitute teach there, but with all that being said, I'm going to tell you, with all the problems and all the situations that we have today with our children, you would never in your life believe the magnitude of what it is, how beneficial it is for our teachers and our people, whether it be service personnel or whomever it may be, to be able to be with our children. For crying out loud, there's every need that, you can't imagine. You can't imagine the complexities that our kids are going through today. You can't imagine the number of kids that contemplate, and God forbid, the number of kids that we end up with suicide. you can't imagine the magnitude of the problems. And so just having that adult face and a face that these kids know and there, it is so meaningful. But Secretary Burch or Superintendent Burch, you take it from there, sir.
Governor, you spoke, especially as a coach, and many of our coaches, we heard that over the entire summer. They definitely needed these children to be engaged. I've continued to talk about we're not wired to be alone. This was a very tough time for us all, even as adults, but for children, it was very tough. We knew it was important for them to be in school. And the interesting thing, Paul, is that all 5 finalists for the Teacher of the Year, the winner for the Service Personnel of the Year, and then yesterday the entire roundtable at Jefferson, every one of those individuals, the very first thing they spoke of was the social and emotional needs of these children. And how important it was. So we've had to put more resources in, that is correct. For the public to be aware, we have a new office we created not long after I took office. We have an entire office dedicated to children's well-being. That is the social, emotional, all the work we do with communities and schools and the First Lady, all the work we do around Project Aware, opioid crisis, social, emotional support. We have an entire staff dedicated to just that. And it was the #1 asked training prior to entering school. And as we've traveled around, it's been the #1 topic. But I believe that topic has made its way over, if I'm not mistaken, to DHHR and Secretary Crouch. Is that correct?
Yes. I'll just add that I've spoken before about the number of referrals for abuse and neglect, and that those were down for some time. And as Clayton says, and as the governor says, it is so important to have one adult or more adults have eyes on those children. And we have spoken to those individuals through the local health departments who communicate with the teachers, and there's a good relationship there. And the teachers are just absolutely incredible in terms of notifying folks who need to be notified if there is an instance of suspected abuse or neglect. So we thank them for doing that, for doing what they do every day. Those numbers are back up, so we're more comfortable now with regard to having some assurance that children who need assistance, who need our help, are getting that help. But we have that concern every day that we make sure every child out there who is in the presence of an adult, whether it be a neighbor, a teacher, or whatever, notify us if there is a concern, and we're happy to look into that. Thank you.
Governor, I'll turn it back to you.
Well, I think we've had a lot of great discussion today. I appreciate the great questions, and you know, I'd just like to say, just to summarize real quickly, I would caution all West Virginians again to not go to sleep at the switch. We got a long way to go. You know, we're absolutely zeroing in to hopefully get to a vaccine, the sooner the better. Without any question, West Virginia, don't let your guard down. I congratulate Kanawha County and everything from the standpoint, you know, we want all of our counties and our kids to have the ability and the right to go back to school. And so I'm hopeful that this holds up, and as we go forward, we'll continue to test. But more than anything, way more than going to school, way more than any kind of sporting event and everything, we found 85 people that we can shut down from the standpoint of them spreading to others without even knowing it, and us absolutely then chasing our tail trying to figure out how to stop this. So that's really going to be helpful, and that's great work by a lot of people and everything. I want to really quickly echo what Dr. Marsh said. It's as simple as this. As you look at infection and the infection rate versus the positivity percentage, if you just think about it, when you go out like we did in Kanawha County and you test 2,000 people, the number of infections, just the pure number of infections, has got to go up. It has to. We're finding more people. It has to go up. But the first indicator is the positivity percentage, or the percentage of positive. That has got to go down. And so that will probably be the first thing that goes down. The infection rate will be absolutely the first thing that goes up. But then what will happen, what we think, what we hope and pray will happen is as we find these people, the infection rate goes down and the positivity rate goes down as well. And so that's what we want. You know, if we find the super spreaders and we're able to stop them, you know, that is the absolute key to everything here. And so I again congratulate all those that put in all the licks. You saved lives. You saved lives. That's all there is to it. By identifying those 85 people, you saved lives. And I don't know what could be more motivational to you in your life than just that. And so as we wait on the possibility of an additional stimulus package coming, we're going to continue to try to do good work in West Virginia. And I congratulate and I thank all those that are putting in the licks, and we're going to keep at it. Thank you so much.